So obviously the whole discussion of strict versus kipping pull-ups is a huge bone of contention and is quite often a controversial topic. We have to understand why strict would be used, why kipping would be used, where the dangers lie, and how to help to mitigate this danger. Now, firstly, it's important to remember that exercises exist on a continuum. We don't have good exercises and bad exercises. It's not binary. We have them existing on different points on this continuum. Just like walking and running. Each of them has a purpose. Each has a use. There are certain times you would walk, certain times you would run. One may be inherently more dangerous than the other, but that doesn't mean that it shouldn't be used. So firstly, why do a kipping pull-up? Well, the idea with a kipping pull-up is to get more work done in less time. So we're looking at power, and power equals force multiplied by distance over time. And by using a kipping pull-up, we're actually maximizing how much work we can get done in a set period of time. So this can give us all the associated benefits of intensity. Not only the athletic benefits, but also the benefits to health, which come from that higher intensity exercise. If we want to look at any of the negative effects that we may experience in a kipping pull-up, we must look at them in the context of injury. Because in the end, any sort of musculoskeletal injury or dysfunction caused by a movement, if we can minimize it, is going to improve the effectiveness and the safety of that movement. So firstly, we need to understand why injuries occur. And injuries can occur, broadly speaking, in one of two ways. Injuries can occur because we have some sort of one-off acute overload of a tissue, or we can have more of a long-term chronic overload of a tissue. In the end result is pretty much the same, and that is we have a breakdown in the tissue. So if the load being applied to that tissue is greater than the ability of that tissue, that muscle or tendon, to resist that load, then an injury is going to ensue. Again, it can either be an acute injury, like a chop through with a knife, or a chronic overuse injury, like getting a nail file and gradually wearing through the fibers. So the aim here is not to overload a tissue to the point where that tissue is damaged. And it's that overload which starts to become a danger when we start to look at some of these more dynamic exercises. In the analogy we used before, a running as opposed to walking, or the topic of this short video, a kipping pull-up as opposed to a strict pull-up. It's important to understand that there are three different subsystems which exist in most of the joints in our body, and in the case of a kipping pull-up, in the shoulder girdle. So for this example, we have an active subsystem, a passive subsystem, and a control subsystem. Now the active subsystem are those tissues in the shoulder which are responsible for creating or resisting movement. So we're looking at things like muscles, and we're looking at tendons. Again, either creating strength and movement, or creating stability or the ability to resist a movement. Then we look at our second subsystem, which is the passive subsystem. And the passive subsystem is more responsible for keeping structure and maintaining shape. So again, in the case of the shoulder, this would be the skeletal system. So the humerus, the scapula, and the clavicle. And also those ligaments which run through the shoulder to help to keep that shape and that position and that stability. Our third and final subsystem is the control subsystem, and these are the nerves which tell the muscles what to do to be able to maintain position and to be able to create movement. So what we want to do is look at these first two subsystems in the context of a kipping pull-up and in the context of shoulder injuries with a kipping pull-up. We want to look at our active subsystem and we want to look at our passive subsystem. We want to look at the muscles and tendons and the bones and ligaments which comprise a joint. Now, to understand the potential danger of kipping movements, we have to understand the role that these subsystems play. And it's important that each subsystem is responsible for its own role and not trying to take on the roles of the others. So when we're doing a kipping pull-up, because of the fast, powerful, dynamic nature, we need to make sure that what is moving and what is resisting movement is the active subsystem, those muscles and tendons. And what is holding shape and providing structure is the passive subsystem. Now, like I said, the problem arises when the passive subsystem, those bones and the ligaments, tries to do some of the work that our active subsystem, the tendons and muscles, should be doing. So if our muscles aren't strong enough to be able to resist movement and create stability through the shoulder joint, if there's not enough strength there, the only thing that your body can do is fall back on the ligaments and on the bony structures to try and create that support. And that's not their role. Because it's not their role, because it's not what they've evolved to do, they aren't well suited to that purpose. And if we go back to the cause of injuries, some sort of overload or some sort of load being applied to a tissue which is not strong enough to resist is when we start to get some issues occurring. So the problem arises when a subsystem is trying to take on the role of something else. So in this case, when our active subsystem, when our muscles and tendons are not well enough conditioned to be able to take on the load which is being applied to it through the shoulder, through a kipping pull-up. So the challenge in terms of how we eradicate this issue is to be able to create a strong enough active subsystem, strong enough muscles and tendons that it's able to take this strain. And just with anything, if you do too much too soon or do the wrong things too much too soon, you're going to start to get these overuse injuries, or you're going to start to get these acute injuries. If we can strengthen this active subsystem, strengthen the muscles, create stability through the joint, it means that we're not then falling back on a system which is not evolved for this purpose. So how can we protect the shoulder girdle from injury in kipping pull-ups? Well, there are 3 really good guidelines that we can take on to ensure that we can maximize all the benefit of high rep, fast movement, increased power, and therefore increased intensity. The first of these is to set quality criteria for the kipping pull-up. So all too often we look at movements as a start point and an end point. An air squat, for example, the start point is fully extended, hips and knees open. The midpoint is with the hip crease down below the top of the kneecap, and the end point is again with hips and knees open. But sometimes we don't give enough importance or place enough importance on what happens between these points. The same thing with a kipping pull-up. If we're looking at the pull-up starting with full extension and ending with the chin over the bar or the chest in contact with the bar, it's not just these 2 positions we should be examining, but what happens between them and how we go from a start position to an end position and vice versa. So the first of our 3 strategies here is to make sure that we are judging and counting movements in training by the quality of the movement, setting quality criteria. Maybe it's not allowing an internal rotation of the shoulder at the front of the kip. Maybe it's not dropping straight down, but pushing away to encourage that scapular stabilization and the use of your lats, part of the active subsystem, instead of just relying on these bony structures and on the ligaments to create strength and stability, which again is outside their role. The second thing we can do is make sure that we're incorporating strict pull-ups into training. And again, I don't believe this needs to be a binary choice. It's not strict or kipping. It can be strict and kipping. Now, when you're incorporating these more slow, slightly more controlled movements like a strict pull-up into your training, it's putting the onus squarely on the active subsystems. And it will mean you're only able to progress and improve both in volume, in load, or in any measure of intensity. You're only able to progress once the active subsystem has strengthened and stabilized to a point where you're able to do the movement. So it doesn't mean only do strict. It doesn't mean only do kipping. It means incorporate both and maximize from the benefits of each. And finally, you should be completing some sort of work to help to strengthen the stabilizers of the shoulder girdle. So we're looking at elevation and depression, retraction and protraction. And the role of the stabilizers is not to create movement, but to resist movement. And in this case, we're trying to improve our ability to resist the protraction by working the retractors, to resist retraction by working the protractors, and the same thing with elevation and depression. So if our scapular stabilizers are good, we can maintain good position and we don't fall back on relying on the passive subsystem where we start to do damage to things like the tendons and cartilage and other structures which are involved in keeping structure of your shoulder. So those are the 3 things we can do. Making sure we're judging the movement on quality, not just completion. Make sure that we are doing strict as well as kipping pull-ups as part of our training. And then working on improving the scapular stability through more isolation accessory-based work. So these are your key takeaways in terms of kipping versus strict pull-ups and how we should find that good balance. The first thing, remember, there are no good exercises, there are no bad exercises. There's no binary, there's no black and white. They should exist on a continuum. Our job is to push the safety and effectiveness and efficiency of these exercises towards that positive end of the continuum. And the second thing is, every movement has risk. It's our job to try and mitigate that risk, to try and be smart, responsible with our training, to use some of these strategies that we've talked about to make sure that you have as much benefit as possible and try to minimize the risk as much as possible. Hope this helps. Take these away, implement them in your training, and remember, no good and bad exercises. It's how you do them that counts.